time period, finally both the houses, upper house also, has passed Indian Commission of Allied and Healthcare Bill. So let's have a clap for all the fellow optometrist friends and who really struggled hard for this time period. Let me share a small story with you. In the early 2000s, I had a fortune to meet then our respected Prime Minister, Mr. Atal Bihari Vajpayee, and whom I was a very great fan also. And I have one relative who was then telecommunication minister also of the state, Mr. Tapan Sikdar, who hails from Vardhan city also. And because of Tapan uncle, I could meet Mr. Atal Bihari Vajpayee for a smaller time period. And that time is a time when nobody knows about optometry, and in India in the great scale, and in eastern part of India it's the similar thing. So when meeting him, they were discussing about blindness problem in India, how it is aggressively increasing in respect to the world scenario. And so that time, that is the beauty of a visionary. So that time only, Mr. Atal Bihari Vajpayee, I would like to share with you. He told there were secretaries. I don't know the names. There were secretaries sitting in front of him. He was telling him to find out the data and how we can improve the primary healthcare system and also the primary healthcare system delivery. So there are two different things. One is the primary healthcare and one is the end delivery system. So there will be also tertiary care, but secondary care, but primary healthcare is very, very important considering the population of India and a country like China has, and how the myopia and the blindness globally has been into the talk of the town, and it is increasing as an epidemic. So that time only the foundation has been laid, and after I really I'm thankful to Dr. Vardhan and our Prime Minister Narendra Modi and his entire team. And I do remember Mr. Arun Jaitley at this time. In 2018, when it is tabled in the House, nobody has thought that so quickly and so efficiently this government has. I really salute. In India, things do take time, but I really appreciate the motive behind it and the larger motive behind it of this government. And it's a privilege and it's a proud moment for all allied healthcare professionals and healthcare professionals like me. I'm also a proud optometrist. So during that time in 2000, the optometry was not of the great. Nobody knows. Whenever anybody asks us what you do, so we explain that we are vision scientists and we are vision care professionals. So it's a degree course run by the Technological University. It has biophysics, biology, anatomy, all the courses, and it's a 4 years long course, and you have to pass each semester by practical examination. You have to work in the hospitals. You have to work under an ophthalmologist. You have to learn from the ophthalmologist. You have to see patients independently. You have to diagnose. So nobody understood. So we all, last 20 years, we all have some definitions we got from World Optometry Organizations and others. But now it's a moment of pride and privilege because of Narendra Modi government and Dr. Vardhan and team that we finally have ISCO code from the ILO, and we have an Indian version of the recognized optometry definition. So I read this for you. So the ophthalmic sciences professionals. So first let us understand what is ISCO. Any occupation comes under the International Labour Organization, and any occupation has to have a regulation, a regulatory body, and it has to be regulated. The education has to be common, has to have a common minimum program, and it has to be regulated of that country law, with the country law for the healthcare and medicine and others. And this International Labour Organization has got a body and like which has got a coding system for each and every occupation. It's called ISCO. It's like international classification of occupation. So under this classification, each courses gets some code, and it is very officially recognized pan country. So let me read out the definition which this bill, Indian Commission for Allied and Healthcare Professional Bills. So read about optometry. It says ophthalmic sciences professional is a person who studies eye related ailments and specializes in the management of disorders of eye and visual system, limited in scope and complexity as performed by a medical doctor, having optometrists with a minimum of 4 years bachelor's degree, and ophthalmic assistants or vision technician with a minimum of a 2 years recognized diploma program. So that is the definition which is now approved and by both the houses, and the bill is being approved. And I want to mention few codes, ISCO codes, which will be helpful for all of you in the time to come. So what is all about the optometrist code for ISCO code has been given 2267. I repeat, the optometrist ISCO code has been given 2267. The ophthalmic assistant code has been given 3256, and the vision technician code has been given 3256. So the thing is, if we have to eradicate preventable blindness from India and globally, it's a teamwork. It's really a teamwork. Alone, nobody can do anything. So the leadership in this arena has to be given by the tertiary care hospitals. I really want to mention that this fight of regularizing and recognizing optometry was never been possible with the help without the help of tertiary care hospitals like Shankar Netralaya, LV Prasad Eye Hospital, Arvind Eye Hospital, and also in eastern part Disha Eye Hospital, Shushrut Eye Hospital, BBI Foundations, and others. So if a patient or attendant of the patient or for that moment the larger community, if they will not understand about what is quality eye care, they will not be satisfied, and they will not understand what is and why the importance of this particular profession is. So that's how the role has been played successfully by these tertiary care eye hospitals in last few decades, like around 2 to 3 decades. They have successfully segregated the importance and the arenas of these healthcare professionals, and they have actually helped the patients with the eye care ailments and distributing the work and making the work easier for the ophthalmologist who do surgery. And without the data and without the help and the support from optometrists, vision technicians, and ophthalmic assistant, it is not been possible. And in this context, I do like to mention the names of our primary, the national primary body AIMS, and the role of the huge role of AIMS, and so we could not the thanks is not enough really to these tertiary care hospitals and AIMS. The last few decades, how they have without any title, without any recognition, how that larger team has served the country and served the blindness problem in India. It is commendable, and they deserve a salute from our end. So now coming back to optometry and this profession. So the primary healthcare is one thing, and the service delivery, the end service delivery is another thing. So after this bill, the bill has been already approved, and now they say that in 6 months' time it has to be implemented by. So there will be a primary national council, and under the national council, all the state councils bodies will be formed, and it will be properly recognized bodies and elected bodies. Like it will have a chairman, it will have a associate directors, secretaries, and entire team members. ministers to take care of that particular state and take care of the National Council. The National Council Commission will work in hand with the state council bodies to eradicate the larger mission, that is the prevention of the blindness from India. And the most importantly, that the regulating the education under a common minimum program pan-India, it is very important. The bill says that after this bill has been passed from both the houses, that the common education will be common for all, and it has to be there will be an examination. Everybody has to pass that examination if they have to practice independently this optometry or along with any tertiary care hospitals. They says that a minimum of 2,000 hours to 3,600 hours is required, that is course up to 3 years to 3 to 6 years course which is required to pass out, with a practical internship which is very important or pivotal. So more or less, like, it's a very welcome move from all of us, and this is the stepping stone. This is just the start, and it is the stepping stone. After this first step, our role is to work as a team with all the governing bodies, all the government, all the medical ophthalmologist, and with the vision technician, ophthalmic assistant, and together with all the optometrist friends and the fraternity, we have to help the government to eradicate the blindness from India, and also to improve the healthcare system delivery, and which is the main aim of this government, to spread out healthcare system, affordable eye care and healthcare system pan India to remote villages and to everywhere. So let us celebrate this moment, and again I want to thank Dr. Vardhan and our Union Health Minister, our Prime Minister Narendra Modi, and the BJP government for tabling this bill, to passing this bill successfully. And I hope that after implementation of this bill successfully, there are some gray areas, like how the optician work will be recognized, and will the optician has to undergo some examination. So in time to come, I am sure that the government will bring some light into it. And also, most importantly, this bill, after this bill has been recognized, there will be a huge opportunity for the upcoming optometrists and the upcoming education institute. Also, there are not only optometry, there are other 53 to 56 courses which has been recognized under this allied and healthcare professional bill by Government of India, like occupational therapy. So anybody who is thinking to come up to the education sector, any company which is thinking for coming up to the education sector, or to occupational therapy, or to rehabilitation therapy, or for optometry, for that saying, so it is the right time to venture into, and because together we can, and together we definitely we will. So with this note, I leave, if anybody will require the actual bill copy, the description will be given in the link, and you can read the entire bill also, and I'll be sharing the official copy of the bill, so that there should not be any ambiguity. You should go through the entire bill. And again, I repeat my final word, that we are a team of team led by ophthalmologists, respected ophthalmologists, and optometrists, friends, and ophthalmic assistant and vision technician, and the volunteers, the NGO volunteers also. I would like to take their names also. So together we have to take a pledge by 2030 or 2040, at least from the current scenario of the blindness scenario in India, in the global perspective. Everybody call India as a blindness capital, so we have to change this thought. And young people like us and will be the flag bearers in the time to come, and really we should work hand in hand with this government, because this government has shown some courage to do the reforms, and not only they talk, they deliver. So once again, clap for this passing of this bill, and let's hope for the best, and we have to work as a team to eradicate blindness from India. Thanks a lot. Have a nice day.